Good morning, dear guys. So today we start the record and continue set of lectures about infectious process. As I said you in previous lecture, and also today we'll discuss the transmission and dissemination of microbes and how and the routes by which they can enter in our body, and how can we prevent it. Also a little bit we'll discuss it, and also what the pathogenesis of this. And actually, you already know the main process which are related to this related to infectious process. They were discussed in an inflammation topic and also in immunology topic. So that's why nothing will be not too much new for you will be from today class, but it's just like compilation of information from previous explanations. Okay, so first of all, let's talk about routes to entry of microbes. Microbes can enter the host through breaches in the skin by inhalation or ingestion or by sexual transmission, and also a few more examples we'll discuss. Okay, so let's start with the most obvious thing to think by which it seems like the bacteria can enter. It is the skin. So, but you know that skin is a dense keratinized, so it certifies squamous keratinized epithelia, yeah. And in histology, you discuss that this keratinized layer, so don't allow bacteria enter inside because of very dense appearance and very densely attached cells to each other, and multiple pairs of them. They prevent the passage of bacteria towards basal lamina, towards the basal membrane. So guys, please don't interrupt with Amjad, yeah? So when you wanna answer, so please turn on your microphone, but when you don't wanna ask me something, please turn it off. Muhammad Asadullah, yeah. Okay, let's start. So skin. But you see, this is a very well protective layer, so which is composed of which is composed of squamous dead cells. The cells they are so in one hand it prohibits the passaging of bacteria, but in other hand some bacteria Staphylococcus aureus and Candida albicans, they can penetrate it in some special conditions. So infections of skin, they can penetrate only if lesion of skin happens. Only in case of lesion of skin, so with mechanical reasons or chemical or might be chemical, physical injury, or other types of injury, so which happen to skin, might be due to loss of nourishment of the skin and degradation. So anyway, it should be degradation of skin and losing of this well arranged multiple layered appearance. You remember stratified squamous epithelia. Again, stratified squamous epithelia is the most protective against outer environment tissues, and that's why and it has a reason. Yeah, so because skin is outer part and it encounters with a lot of things around. Outer world is contacting with us with the skin, and we have to protect the skin, protect our surface, because environment is not very so it's not only about bacteria, yeah. So skin protects not only about only from bacteria, but also from other types of injuries. And integrity of the skin is a main feature which protects us. And also in last lectures we discussed a little bit about skin lesions like burns, yeah, and which and when skin is degraded, so in large amounts, so you know that it is opens the entry of bacteria. Also, it doesn't keep inner integrity of the body. So if it's lesioned, so that's why you understand that if skin is even a little bit lesioned, so this some bacteria, some microbes can microbiological products can penetrate it. Okay, cutaneous infections are typically acquired by entry of microbes through breaks in the skin. That's the main message I want to deliver you. So that skin must be broken. So they might be wounds, burns. So what is a surgical incision, diabetic and pressure related food source. Yeah, so you remember we discussed a little bit about pressure related food source and diabetic food, source. So it happens due to, first of all, due to inability of normal blood supply of the skin, and it when it's injured, so this opens a direct route to the inner environment. You remember that under the epithelial layer always have a loose connective tissue, always present loose connective tissue with blood vessels, and by which it can penetrate. Okay, but here, okay, let's discuss some details. Intravenous catheters in hospitalized patients provide portals for local or systemic infection. So that's why it might be injurious. Needle sticks can expose the recipient to infected blood and transmit B, hepatitis B virus, hepatitis C virus, or HIV, human immunodeficiency virus. Some pathogens penetrate the skin via insects or animals bite. Bites by fleas, ticks, mosquitoes, mites, and lice break the skin and transmit arboviruses. So as we discussed in a previous lecture, so they can cause yellow fever, encephalitis, so might penetrate bacteria like plaque, Lyme disease, Rocky Mountains spotted fever, and also even protozoa, so like malaria, leishmaniasis, and even helminths like filariasis. So then Pasteurella or viruses such as rabies, only a few microorganisms are able to cross the skin barrier directly. For example, schistosoma larvae released from freshwater snails penetrate swimmers' skin by releasing enzymes that dissolve the extracellular matrix, traversing unbroken skin. Okay, my light was temporarily off, so now we'll continue. I said, yeah, that some bacteria can penetrate the skin with the help of some bites, with help of bites of insects or other animals who can injure our skin. So that's and as I said, it's bites by fleas, ticks, mosquitoes, mites, lice. They can cause yellow fever, encephalitis, like plaque, Lyme disease, Rocky Mountain spotted fever, protozoa like malaria, leishmaniasis, and helminths like filariasis. Animal bites can lead to infections so only with bacteria such as Pasteurella or viruses such as rabies. Schistosoma larvae release they can cross skin barrier without any help. Can penetrate from freshwater snails, penetrate swimmers' skin by releasing enzymes that dissolve the extracellular matrix, traversing unbroken skin. So by the same way, some fungi, as they can directly infect stratum corneum and the skin, hair, and nails. But usually they don't penetrate deeper, because deeper we have our immunity system, very good immunity system, which don't allow it penetrates deeper. So, and as we discussed in previous lecture, so they can break entire skin only if we have immunity loss. So in case of immunodeficiency. Okay, gastrointestinal tract. So how bacteria can penetrate the
Sir,
gastrointestinal tract? Yes.
sir, in the road accident, when someone fallen on the road, they got injected TT injections or tetanus vaccine. Are they also entering through skin, sir? Through skin injury.
Again, so your voice was interrupted. So again, who can penetrate through the skin?
Sir, in road accident, when someone fallen on the road, sir, and become injured their skin,
Yeah, of
then
course.
doctor, sir, suddenly inject him tetanus toxin injection, sir.
Of course, yeah, of course. Any wound which any wound of skin can cause contamination of bacteria there. And most dangerous for us, as I said in beginning, is Staphylococcus aureus, and Candida albicans is less important, but Staphylococcus aureus can penetrate it. This normal, they are known opportunistic infections. They can penetrate it, of course. So and usually we care about Staphylococcus aureus. And and also it might be you heard about it that every medical so every medical employer, yeah, so once in half years they pass the smear from oral cavity for staphylococcus and nasal cavity also for staphylococcus aureus. It's absolutely opportunistic, so it means it's not dangerous for carriers, so not so dangerous in carriers, but if injury to mucus or skin happens, this Staphylococcus aureus can penetrate into this lesioned skin, and they cause diseases. And the most common complication is the sepsis, septic shock, so which causes death. That's why all the doctors they have to submit this test for Staphylococcus aureus, and if they are positive for Staphylococcus aureus, they have to get treatment, antibiotic treatment for 1 week, and only after this week they can continue their practice as a doctor. And to be fair, actually most of doctors they have the Staphylococcus aureus in their body, because they have to encounter with the patients with contamination of Staphylococcus aureus which present outside the hospital. But anyway, it present. And most of intra hospital diseases. So why patients with diabetes mellitus died. Yeah, so why patients with stroke, brain stroke died. Usually they died because of lung inflammation. It's like pneumonia, which is caused predominantly by Staphylococcus aureus, because their bodies are already suffered with the lack of immune system, and this Staphylococcus aureus provides a destructive process in lungs, and it is like complication. They never say that it's a prior disease, but usually main cause of death in intensive care unit is related to Staphylococcus aureus, and because Staphylococcus aureus, which we can find in hospitals, they are super bacteria. They are very they are resistant for antibiotics. That's why even antibiotics can treat them. So this Staphylococcus aureus is safe for, as I said, they safe for a healthy person. But when person is constantly so can't move, yes, then the circulation of blood is reduced, immunity state is unstable, so it can cause infections. Okay, we'll discuss it soon. Yeah, and when we do perform the surgery, also during the surgery, the Staphylococcus aureus can penetrate into wound. Also, even in car crash, as in your example, so then the skin lesion so might be infected by bacteria, and but with the first aim after the car crash or any other crash of the skin is to prevent insemination of this wound with the bacteria. So that's main idea. Of course, any lesion of skin can cause it. So that's why you heard, yeah, so from childhood, when you have some injury to skin, you have to smear it with some antiseptic, like spiritus, or at least hydrogen peroxide, or some other antibiotic smears, yeah, to prevent remove bacteria in one hand, and second hand to kill bacteria which possibly can penetrate into the wound. That's why main idea. So after any injury to the skin is antiseptics. So to remove inseminated bacteria and prevent, and aseptics to prevent bacteria entering into the wound. Yeah, of course. That's why you smear. So before even injection, so which is performed by absolutely sterile needle. So you have to smear the skin with antiseptic like spiritus. Yeah, and with alcohol. And then this alcohol so prevent so just wash this mm, because we always have on skin we always have some bacteria, and especially staphylococcus aureus is always present, and you can do nothing with it, so because staphylococcus aureus everywhere, and usually doesn't give some symptoms. Okay, I hope I answered your question. Okay, then gastrointestinal tract. So how gastrointestinal tract so affect our body? So how our gastrointestinal tract can be contaminated with bacteria. So some you know a lot of gastrointestinal tract bacterial infections. They usually have one common consequence. It's diarrhea. Yeah, so you heard about it. And here let's discuss about the most interesting and most dangerous in past bacteria, which known as Vibrio cholera. Um, you know that Vibrio cholera is infecting not all persons. Vibrio cholera can are dying in a stomach with a proper acidity level in the stomach. Yeah, so when stomach is stomach acid kills this Vibrio cholera, but if you drink water before it, or might be stomach acid is neutralized before you drink water contaminated with Vibrio cholera, so then Vibrio cholera can pass into the lower parts of the gastrointestinal tract, and it causes an infectious dose. So an infection can penetrate in lower parts, and you know that Vibrio cholera predominantly contaminated so uh, contaminated the lowest parts of digestive tract is a colon, yeah, and in colon it acts in specific way. So in infectious disease you will discuss it. As they're exotoxin, they prevent some proteins there, so which cause the releasing of water through the colon and loss of water. But okay, it's another point of discussion. But main idea is the gastrointestinal tract is also well prepared, well preventing the passaging of bacteria, especially by stomach acid, and only dilution of stomach juice, or might be use of anticides. So they don't prevent a lot of bacteria. They cannot prevent a lot of bacteria entering into our digestive tract. Okay, but such bacteria like Shigella and Giardia, they are relatively resistant to gastric acid. So fewer than 100 organisms can cause illness. So, but actually, in some bacteria we used to name it as infections, but they can enter in our body. For example, yeah, botulism. For example, botulism is a typical infection. So we talk about it in infectious diseases, but in botulism way. It actually don't. But bacteria doesn't affect the body. So actually, it's a poisoning by botulism. So you'll discuss it because what poisons us? Not bacteria itself, but their exotoxin, and bacteria don't survive after this. Bacteria died after the ingestion of this, but their exotoxin, which is released, so it can kill us. So that's why it's not classical infection when we have seeding of bacteria there. So there are a lot of infections which are not actually infections. They are just work as a poisoning. Okay, we'll discuss it. We'll also discuss it later. Okay. So, in which normal defense mechanisms in digestive tract we have? So, first of all, the layer of viscous mucus covers the intestinal epithelium. Yeah, you know that mucus is viscous, and most of bacteria they just can't penetrate it. They just don't pass towards the epithelial cells, and the epithelial cell lining is also preventing the bacteria entering into the adjacent connective tissue. The main aim of bacteria is to penetrate into adjacent connective tissue. Then lytic pancreatic enzymes and bile detergents. Pancreatic enzymes, you remember, they can dissolve everything, even proteins, lipids, carbohydrates, and most of bacteria died in proper with the proper secretion of pancreatic juice in the duodenum, and they don't create infection. Then bile detergents, they also emulsify fats and all lipids, and for example lipid compounds which are present in the cell membrane of bacteria, they also can be emulsified, and of course cells died because of it. Bacterial cells died. Then mucosal antimicrobial peptides called defensins. So mucosal antimicrobial peptides, they're released there, so by epithelial cells, and also they can kill this bacteria. Normal flora. So I said it before. Yes, the normal flora is very important to keep our bacteria amounts, and to keep our integrity of digestive tract. And when normal flora is compromised, so then another bacteria can settle there, and for example, in one person with a good flora of digestive tract, so Shigella cannot cause the infection. But if normal flora is compromised, so of course Shigella can easily settle in digestive tract and cause this infection. And don't forget about IgE antibodies. So we discussed, yeah, we have different classes of immunoglobulins, and IgA antibody, IgA. I said IgE, yeah. IgA antibodies. They are acting like mucosal antibody. So it's mucosal antibody which is excreted in by not into blood as it classically goes, but into the mucus, and it performs its function there. So it causes opsonization of bacteria in outside the blood. So that's immunoglobulin A importance. So, but if we have IgA, so must be we have some lymphocytes which produce it, right? We have some plasma cells, and plasma cells are located usually in lymphoid organs. And in the digestive tract, we have very important lymphoid organ, lymphoid tissue, which is name is MALT. And you heard about it. It's mucosa-associated lymphoid tissue. Mucosa-associated lymphoid tissue. So this mucosa-associated lymphoid tissue is present along all the digestive tract. So there, it might be diffuse lymphatic tissue in upper parts of digestive tract, but in lower parts, like in ileum. So we have structures which are known as Pierce patches. Pierce patches, they're a collection of B lymphocytes there, and they produce the maximum amount of immunoglobulin A. Which prevent some bacteria, so some specific types of bacteria in digestive tract in our body. And actually, and one more thing, and we have M cells. Here they named as special epithelial cells, M cells. These epithelial cells, they are like carriers of lymphocytes. So these M cells facilitate the penetration of lymphocytes towards the again light off. Okay, let's continue. So you see that M cells, there are specific cells in the digestive tract, the specific epithelial cells, which facilitate the penetration of leukocytes, lymphocytes towards the digestive tract. So what's the reason of it? Actually, that's necessary for capturing of some bacteria for testing. So we just test which bacteria are present in digestive tract, and that's why might be heard that our normal flora maintain our immunity, and that's true. And by this, our body encounter with the bacteria, and then these lymphocytes work as antigen-presenting cells, and they present these antigens to mucosa-associated lymphoid tissue, and then our body can renew their ability to kill bacteria. And that's why normal flora is acting not only by prevention of new bacteria entering there, but also normal flora maintain our immunity state, because our lymphocytes, they can check new and always new and new antigens, which can be captured by from the flora. So that's why that's the role of M cells. They just M cells. If you don't remember it from histology, I remind you that these M cells are like empty cells, which cause a penetration. Which cause a penetration of basement membrane and let the lymphocyte to enter, get closer to the digestive mucosa. Okay, numerous gut pathogens use M cells to enter the host from the intestinal lumen, including poliovirus, enteropathic Escherichia coli, Vibrio cholera, Salmonella enterica, serotype TB, and Shigella flexneri. So you see that's how our that's how you know that we have some vaccination, yeah, against these bacteria, and that's necessary for our mouth. Or sometimes this mouth of the digestive tract is named as a GALT, gut-associated lymphatic tissue, lymphoid tissue, and this and when our lymphocytes are already marked with so they already know with this antigen, they can produce antibodies, IgA, against this antigens of bacteria, or we have and or cytotoxic T lymphocytes are present there, and when infection even damage the epithelial cells of the digestive tract, we can easily destroy them by cytotoxic T lymphocytes, and prevent spreading of this disease in other in other places. You know that epithelia of the digestive tract is renewing epithelia, so it has a very high opportunity for high opportunity to manage the digestion, and so that's to manage the cell division, and the cell divisions are renewed of the digestive tract, so allow us to sacrifice the cells, infected cells, in fate of our body. Okay. Infection via gastrointestinal tract occurs when local defenses are weakened, or the organisms develop strategies to overcome these defenses. So as I said before, yeah, this okay, host defenses are weakened by low gastric acidity, as we said before, by antibiotics that alters the normal bacterial flora, and so, for example, pseudomembranous colitis due to difficile Clostridium difficile, they can settle in digestive tract after the use of antibiotics, or when there is peristalsis or mechanical obstruction happens. So when peristalsis is stopped, so normal circulation of blood also interrupts, and bacteria can evolve themselves in these tissues, in this area, when no passaging goes, and also and it can create some troubles. Okay, then viruses that can enter the body through the intestinal tract, like hepatitis A or rotavirus, they that lack envelopes, because enveloped viruses are inactivated by bile and digestive enzymes. Okay, let's talk about enteropathogenic bacteria cause gastrointestinal disease in several ways. So first thing, which is most important for us, this toxin production in food. Toxin production in food. So you see, for example, Staphylococcus aureus, Bacillus cereus can contaminate and grow in food, where they release powerful enterotoxins that, when ingested, cause food poisoning without any bacterial growth in the gut. So you see, it's not classical infection, as I said before. So another example, as I said, is botulism, Clostridium botulini. So it causes the formation of toxin in food, and then when we ingest it, so it's damage our digestive tract. So then next is adhesion. Adhesion, local proliferation and toxin production in the host. As example, Vibrio cholera is enterogenic, and enterogenic Escherichia coli bind to the intestinal epithelium and multiply in the overlying mucous layer, where they release exotoxins that cause epithelial cells to secrete large volumes of fluid, resulting in watery diarrhea. As a pathogenesis of this, you will discuss in infectious diseases. And invasion. So adhesion, when it's attached to the surface, yeah, and invasion when it penetrates deep in a mucus. So, for example, Shigella, Salmonella, and Campylobacter invade locally and damage the intestinal mucosa and lamina propria, causing ulceration, inflammation, and hemorrhage. Changes manifested clinically as bloody diarrhea, and also another name of this syndrome is dysentery. Shigella enterica, serotype Tifi, Salmonella enterica, serotype Tifi, passes from the damaged mucosa through Pear patches and mesenteric lymph nodes and into the bloodstream, resulting in a systemic infection. So you see, they can use our own immunity system, our own lymphoid tissue to penetrate in the rest of our body. And like Salmonella Tifi or Salmonella enterica serotype Tifi, so it also can cause systemic infection.
Sir,
Yes.
sir, but before they are going to the bloodstream, sir, the lymph node can kill the bacteria.
Yeah, and they have and later we'll discuss it. So a lot of bacteria they can evade the normal immune response. So most of bacteria which attempt to pass this border. So yeah, of course they can't. They're defended with immunity. But if we have but in some cases they can evade the normal avoid the normal immunity response, and they use our immunity response for their own needs. So that's a very tricky mechanism. We'll discuss also very soon, so in rest of topic. Okay, we have fungal infections yeah, of gastrointestinal tract occur in immunologically compromised individuals. That I said in HIV usually, in AIDS usually. Yeah, Candida, part of the normal gastrointestinal flora, shows a predilection for stratified squamous epithelium, causing oral thrush or membranous esophagitis, but also may spread to the stomach, lower gastrointestinal tract, and other organs. Only in immunocompromised individuals. Yeah, so in AIDS usually. Most intestinal parasites enter the body by being ingested as cyst, eggs, or meat-borne larvae. But if you enter by penetrating the skin and finding their way to the intestine, so like example, Lamblia. Lamblia attached to the epithelial brush border, but does not invade into cells or tissue. Attachment of the organisms lead to blunting of villi, loss of brush border, and malabsorption and chronic inflammation through mechanisms that are poorly understood. So then cryptosporidia is taken up by enterocytes in which they replicate, leading to extensive mucosal damage, villous atrophy, and inflammation. So you see, same. It first of all, it causes temporarily. So in this period, we have no symptoms, but they attached, and few cells are injured, and they cause a lesion of mucosa, and then after lesion of this mucosa, they can penetrate deeper. So Escherichia histolytica kills host cells by contact-mediated cytolysis through a channel-forming pore protein with consequent ulceration and invasion of the colonic mucosa. Same, you see, it causes ulceration and then can penetrate. And also intestinal helminthes cause disease when they are present in large numbers or travel to ectopic sites. So, for example, lumbricoides can obstruct the gut, and this organism can invade and damage the bile ducts as well. Helminths also cause disease by depriving the host of nutrients. So as we discussed, hookworms they cause iron deficiency anemia by sucking blood from intestinal villi, and we have Diphyllobotrium, the fish tapeworm, causes anemia by depriving the host of vitamin B12. So you see Diphyllobotrium. So if you see a patient with a B12 deficiency, so you can suggest so they have Diphyllobotrium. Okay, and now let's talk about respiratory tract. So how bacteria enter to respiratory tract? Large number of microorganisms, including viruses, bacteria, and fungi, are inhaled daily by every individual. Okay, in easy words, so we inhale, so it's present, they are present as zoles in our outer environment, and we inhale it so from other person, might be so when someone sneezes and you inhale it, yeah, or might be they are present with the dust, on the surface of dust, with the particles, they can penetrate into the respiratory tract. And for to prevent it, we have two mechanisms. First, we already discussed in smoke. In topic of smoking, cigarette smoking. So they are we have mucociliary clearance, and all these particles are usually in normal non-smoking person, so without any lesions of respiratory tract, or these particulates, they can easily removed from the body with the help of mucociliary clearance, and you just cough it out, and then bacteria doesn't enter into your body. Even in case of cold, so usual cold, you know that your respiratory tract is contaminated with viruses, and mucosal lining is also injured, and then bacteria can penetrate deeper. But same on the some level, mucociliary clearance in a mild infection, so it can removed with the help of coughing. That's why we have symptom of coughing due to some viruses, not because virus itself, but also due to contamination of secondary infection, which happened after the cold. So and that's cough. So and that's cough should be so that's why when you cough, it should be productive cough, and this productive cough so means that your body is fighting against it, fighting against and prevent pneumonia, which might be followed with a usual cold infection. So it doesn't work with COVID-19. So because some SARS family of viruses, they can contaminate directly the respiratory tract, directly alveoli of lungs. That's the secondary infection plays less important role here. But anyway, so you know that even in COVID-19, this contamination of alveoli, so it also might be related with the secondary respiratory infection, viral infection, bacterial infection. That's why we use antibiotics in COVID-19 treatment, so to prevent secondary infection. But even with preventing of secondary infection, so viruses can damage our respiratory tract itself. So that's why they are not so effective as in case of usual pneumonia. Okay. Microorganisms that invade the normal healthy respiratory tract have developed specific mechanisms to overcome mucociliary defenses or to avoid destruction by alveolar macrophages. So yeah, and second line of defense, when bacteria or virus even reached the alveolar tissue, in alveoli we have macrophages, yeah, alveolar macrophages, and they play a role of they just ingest these microbes, and usually defend our body. So because you can imagine, yeah, so how much microbes we inhale every time, and some percentage of them, they can penetrate even into alveoli, and alveoli is very gentle tissue, and it has a lot of water, air, blood supplement, and it's a very delicious thing for our microbes. And we can and but here we have defense in a way of macrophages, alveolar macrophages. And okay, but some of them, some of bacteria can avoid this mechanism. So, some successful respiratory viruses evade this defenses by attaching to its entering epithelial cells in the lower respiratory tract and pharynx. For example, some influenza viruses possess a hemagglutinin proteins that project from the surface of the virus and bind to sialic acid now on the surface of epithelial cells. This attachment induces the host cell to engulf the virus, leading to viral entry and replication within the host cell. So that's how especially viral infection is dangerous. So we don't know exact mechanism of COVID-19 entrance into the epithelial tissue, but everything seems like they all use something similar mechanism, to penetrate the respiratory tract. So certain bacterial respiratory pathogens release toxins that paralyze cilia, So as I said, we can prevent mucociliary transport, and they cause the inability of cilia to remove mucus, and is it will cause the promotion of infection. So that's, for example, Haemophilus influenza, Mycoplasma pneumonia, and Bordetella pertussis. So they can possess these features. And then only, but you know that only alveolar macrophages can handle everything. So that's why mucociliary clearance is very important. And if we stop it, if we don't if our cilia don't work properly, so then load of bacteria is too much, and that cause a very dangerous outcome. Okay. Streptococcus pneumonia and Staphylococcus aureus can cause pneumonia subsequent to influenza because the viral infection leads to the loss of protective ciliated epithelium, as I said before. So say all viral infections, it causes contamination of other bacteria. So chronic damage of mucociliary defense mechanism occurs in smokers and individuals with cystic fibrosis, as we discussed. Yeah, so actually now CW, when you prepare the CW, so in every group we had cystic fibrosis topic. Uh, Only in group number one we had no, if I'm not mistaken, cystic fibrosis topic, but they will submit this soon. The cystic fibrosis and in smokers, the mucociliary clearance is already compromised. That's why it can cause a secondary infection. And also patients who aspirate gastric acid. So as I said, in drug abuse, non-medical drug abuse, some medicines, so now some drugs like heroin, they can cause vomiting and sleep. And then when you vomit asleep and then inhale this vomit, so gastric juice can penetrate into respiratory tract, and they dump the proper mucociliary clearance, and then bacteria can penetrate deeply and causing the pneumonitis and secondary infection after this, which is very hard to treat and usually causes death. And then some respiratory pathogens avoid phagocytosis or destruction after phagocytosis. Its example is Mycobacterium tuberculosis. So it gains a foothold in alveoli because it escapes killing within the phagolysosomes of macrophages. They avoid the phagolysosomes in macrophages, and they so tricky that they can settle the macrophages. Yeah, so macrophages envelop them, but they can't kill them. And Mycobacterium tuberculosis, macrophages which ingested the Mycobacterium tuberculosis, they're collecting a lot of this tuberculosis bacteria, and they can't handle it, and they died due to by apoptosis and cause the activation of other chronic inflammatory responses, and more macrophages are collected around, yeah, and then and lymphocytes are trying to kill it, but they cannot, and it causes granulomatous inflammation, as we discussed in the beginning. Yeah, so as we discussed in inflammation topic. So that's why in tuberculosis it's very typical to possess granulomatous inflammation. Okay, opportunistic fungi infect the lungs when cellular immunity is depressed or when leukocytes are reduced in number. So, for example, with Givarecci in patients with AIDS, Aspergillus spores are after chemotherapy, they can settle there. Okay, respiratory tract. We'll discuss much more about this in respiratory tract topic. Now we move forward toward
Sir,
urogenital tract. Yes.
sir, some bacteria in the respiratory tract also enter into the blood and go to other part like TB, sir. They go to the bones. Uh, Sir, they form a granuloma in the lung, sir.
Mhm.
So how they, sir, goes to the other tissue of the body when they are trapped inside the macrophages?
They are trapped inside the macrophages, but you see, that's okay. Actually, we have to discuss tuberculosis like a distinct topic. But okay, in easy words, I can explain it that when macrophages swallows it, and in immunity is okay of this patient, and immunity works in proper ways, they just surround it and form the granulomatous inflammation, and it causes calcification even, yeah, and it causes a very hard protection from dissemination, yeah. But in patients with compromised immunity, so for example, if you got imprisoned in a cold prison, yeah, or might be your social state so doesn't allow you to take enough food, take enough vitamins, so wide range of vitamins, might be malnutrition, malabsorption. So in these cases, normal work of immunity is depressed, and then proper mechanism of granulomatous inflammation is not happen. And then this viruses, then this Mycobacterium tuberculosis, they can infect macrophages and all other macrophages around them, and by the routes of lymphogenic transmission, they can penetrate into the lymph nodes, and from the lymph nodes it penetrate into the bloodstream, and then penetrating into the bloodstream, it's disseminate all over the body. So and that's why you heard about it. That's tuberculosis is social disease. Yeah, social disease. So because social state, decreased social state, cause the evolvement of this disease. But if your immunity state is normal, if your feeding is okay, so you're sitting in a warm homes, yeah, in warm home, in a warm office, yeah. Of course, it's very hard to evolve this Mycobacterium tuberculosis, even if it's present in our body. And I can say that almost every of you, so 90% of Earth's population, we have this Mycobacterium tuberculosis in our body, but we have granuloma, which is separated from the rest of the body, and only if immunity state is depressed, so then it can cause dissemination of Mycobacterium. So I hope I answered your question. And then urogenital tract. So urogenital tract and urinary tract, yeah, it's almost always invaded from the exterior by way of the urethra. So this location of urethra, location of urinary tract along with the genital tract is, as I think, it's a very huge mistake of evolution, because you know that sexual transmitted disorders are very common, and an infection of urinary tract. Um, uh, Urinary tract, they cause also genital tract infection, and genital tract infection cause urinary tract infections alone. So that's very make it very challengeable for treat of them. So that's why just urinary problems, they can create problems in reproductive system, and of course genes are not shared to other person, yeah. That's a very dangerous condition. That's very dangerous for evolutionary responses, and that's why. But anyway, our urogenital tract is pretty well preserved. That's why we have only few infections that can infect both urinary tract and genital tract. And this example is Neisseria gonorrhea. Neisseria gonorrhea, so and also non. So in Neisseria gonorrhea is very specifically damage the genital and the urinary tract. But we also have Escherichia coli. Escherichia coli is a normal flora of digestive tract in urinary tract, urogenital tract. It can cause very severe complications. So let's talk about women. Yeah, so in women, the urinary tract, so urethra is opening very close to genital tract, and normal flora of genital tract, it can penetrate into the urethra just after the sexual intercourse, or might be after the washing out of after the defecation. Yeah, then Escherichia coli, which is normally present in the digestive tract, they can penetrate into urethra just by washing process. That's why in hygiene you discuss that females have to, after they go into washrooms, by for defecation, they have to wash their genitals only in one direction, from anterior to posterior, anterior posterior by anterior posterior movement, to prevent dissemination of Escherichia coli to the genital tract. Yeah, and urinary tract too. And actually, so you heard a very common disease known as cystitis, infection of urinary bladder. In females, it's very common, and I explained these reasons of it. So it happens usually because of improper washing of their genitals during the defecation, or might be related to the sexual intercourse. So when males, they don't care about hygiene, yeah, and after sexual intercourse, there's bacteria from the penis, so which don't bother for males, they can penetrate into the urinary and genital tract. Okay, 1 minute. Okay, and that's why hygiene of sexual intercourses are very important, because it can cause urogenital tract infection. So let's talk about, yeah, reasons I explained. Yeah, that because of anatomical location of urethra very close to genital tract, in females it causes infections a lot. In males, we have so pretty long urethra, and in this long urethra we have a lot of mechanisms. In males, we have a lot of mechanisms to prevent infection passing into the urinary bladder. That's why in males, cystitis are very uncommon. They are common only in the elder age. So when we have adenoma of, benign hyperplasia of prostate. So only in that case. But usually males in young age, so this cystitis, so inflammation of urinary bladder, is very uncommon. Okay, then let's talk about spread of and dissemination of microbes
Sir,
within the body. Yeah.
sir, if someone have sexual intercourse and the men have HIV virus, sir, and
Mhm.
until there is no bleeding, so there will be chances for transmission of the virus if there is no
Very,
bleeding.
very poor. Yes, Amjad, I understand this. It's very poor chances. So actually, in usual sexual intercourse, transmission of HIV virus, HIV is very uncommon. So that's why maybe you heard that HIV virus is spreading in usually in groups of with a sexual violation. So I mean in homosexuals, yeah, which during the sexual intercourse of homosexuals, there are some rupturing of skin integrity happens, and that's allows the penetration of virus into the blood. So only in violations, and also for example, it is chances are increased in case of unlubricated sexual intercourse, when lubrication is not produced in females, and you use lubricants, and with this sexual intercourse, chances of HIV settling is much more increased, because HIV is I understand that HIV is present in sperm, in semen. I mean, HIV is present in lubricants which are released from the females and male body both, and but they can be washed out, easily washed out, without passing into the blood. So that's why not every sexual intercourse with HIV inseminated patient, so it's followed with the contamination of HIV virus. So that's why. So of course, it's better to avoid sexual intercourses with HIV patients. But if we use contraceptives like condom contraceptive, yeah, so then chances of HIV virus are very depressed, very decreased. So that's why don't so much afraid of HIV. So if you use condoms, so HIV is not the danger for you. So that's why if you have a sexual intercourse with someone you don't exactly know, who doesn't have any kind of checkup of HIV, so please use condom. Okay. Spread and dissemination of microbes within the body. Some microorganisms proliferate locally at the site of initial infection, whereas others penetrate the epithelial barrier and spread to distant sites by way of the lymphatics, the blood, or nerves, as we discussed a little before. In contrast to that disseminate pathogens that cause superficial infections stay confined to the lumen of hollow viscera. So, for example, it's Vibrio cholera, or interact exclusively with epithelial cells like papillomaviruses and dermatophytes. Yeah, that's the best thing for us. Unlike other conditions, it's a bad thing for us because they are not spreading, and we can capture this bacteria in the site of their action, in the site of their crime. Yeah, but some bacteria they can spread through the blood. So, and let's discuss these examples. Which mechanisms they use? Lysis and invasion. Some extracellular bacteria, like fungi, helminths, secrete lytic enzymes to destroy tissue and allow direct invasion. So, in the example of Staphylococcus aureus, they secretes hyaluronidase. You remember that hyaluronic acid is one of the main components in our subendothelial connective tissue, and this and the integrity of hyaluronic acid, so it doesn't allow spreading of bacteria, and it through hyaluronidase spreading of antimicrobial products also goes. But in if we have hyaluronidase, it degrades extracellular matrix and makes it fluid-like. It creates a fluid-like structure inside it and causes purulent inflammation, as you remember now, yeah. And that's why they destruct this hyaluronic acid around. And even if our neutrophils enter inside, it creates a liquid material there, so which we name as pus. Yeah, so in and it's good thing that when he Staphylococcus aureus get form the pus in a localized area, because our bacteria can handle it. So our neutrophils can handle it. But if our immunity defense is also weakened, so this Staphylococcus aureus can penetrate into blood vessels and can disseminate, causing the bacteremia, so which is shown on this diagram. So you see, it's injected, and then through the lymphatic capillaries, they inside the macrophages or without macrophages, they penetrate into the lymphatic capillaries, or then into the bloodstream, or into the bloodstream. So it might be both by lymphatics or directly into the bloodstream, and penetrates and can spread to all organs of our body. So here we have example of Mycobacteria tuberculosis. So as you Amjad asked me before, yeah, that macrophages, they work like carriers of this tuberculosis, Mycobacterium tuberculosis, and by lymphatics it spreads to the blood, and from blood it enters in all body tissues. And you know that what is the second most common place of tuberculosis disease? So usually it is a
Sir,
first are lungs, second are kidneys and urinary tract. Yeah, so that you have to remember. In case of varicella zoster or rabies, so the spreading of these viruses goes through the nerves. So through the nerves, and it's a very specific pathway of spreading, which is typical only for these infections. So and these viruses can spread along the nerves, and they can persist inside bodies of neurons, and persist for a long time, but in a time of defense mechanisms lost, so they can cause this infection, and then I wanna pay attention to varicella zoster. But in rabies, so it's another condition. The rabies can cause the brain edema later, so it's a very dangerous condition. We don't have proper immunity against this rabies, and we have to use vaccination. Yeah, and if rabies appeared, so after the bite of animals, like might be wild animals or dog. Yeah, so this rabies, if we have injury of skin, and you suspect that that animal who bite you, who bite you, yeah, so he's it might be infected. So you have to very urgently you have to go to do vaccination against rabies. And then and the time of spreading of this virus along the nerve is very very slow, 1 centimeter a day. And that's why until this time passes, so then your immunity can produce antibodies against this virus, and then you can prevent death. But if rabies reaches the neuron bodies in the central nervous system, it causes, of course, it causes death. So we can do nothing with it. So that's why it's too late. If you have some neurologic symptoms, it's too late to do something with it. Okay, this is okay. Let's talk through blood and lymph. So now I shown it there, so no need to discuss it. And cell-to-cell transmission. Cell-to-cell transmission is more typical for viruses in also in respiratory tract or in digestive tract. So you see. As they enter in one cell, they use the machinery of a cell to produce more viruses, and then a rupture of this cell infected with viruses cause the spreading of this virus to other cells, and they infect other cells too. So that's the main spreading, the main way of spreading of bacteria of viruses is cell-to-cell transmission. Okay, the consequences of blood-borne spread of pathogens vary widely depending on the virulence of the organism, the magnitude of so the magnitude of infection, the pattern of seeding, and host factors such as immune status. So sporadic bloodstream invasion by low virulence or non-virulent microbes during brushing of teeth is common but is quickly controlled by normal host defenses. So as I said, so usually in the blood we have a lot of lymphocytes, leukocytes, other types of leukocytes which can easily eradicate this bacteria. But in some bacteria they cause disseminated viremia, bacteremia, fungemia. You understand? Emia means penetration into the blood. Bivalent pathogens poses a serious danger and manifest as fever, hypertension, and multiple other systemic signs and symptoms of sepsis. So, and I explained you fever, yeah, before already that bacterial cell wall. They possess lipopolysaccharides, and these lipopolysaccharides they can act like directly like pyrogens, and this causes the activation of all immunity systems, and hypothalamus is also activated to produce more shivering of muscles, and the shivering of muscles causes heat production. Massive bloodstream invasion by bacteria can be rapidly fatal even in previously healthy individuals. So that's why bacteria, so massive invasion of bacteria, it happens only after abscess. Might be abscess, rupture of abscess and penetration of abscess directly into the blood. So it can cause massive bacteremia, and this massive bacteremia is followed with sepsis. Uh, Even in healthy individuals, or relatively healthy, of course. Or might be direct injection of bacteria into the vein through the by the medical procedure, or might be during the transplantation of organs which are already contaminated with bacteria. So it can cause, of course, it can cause death by it can cause death made by this bacteria. Okay, even in healthy individuals. Okay, we'll continue this discussion later. So a little thing, a little amount of information remained. So we'll discuss it next time. So now time of lecture is over. So I'll check your attendance. Don't leave. 48 students only here. If you have any questions, you can ask. Okay, thank you for attention. So see you next time. Goodbye.